the main message from me is that smokers' lives matter. So you have this lens of morality that we apply in society. The challenges that we saw for people living with HIV in South Africa was because of looking at them through the moral lens. So they were not seen. They were thrown out of their own homes. They were thrown out of their places of worship because of the association of sex, sin. We have the same attitude towards liquor, towards tobacco, things that bring joy to people. So we celebrate misery, and we are anti things that give pleasure. Now, some of these things that give pleasure can also cause harm, as we know from HIV. So what do we do with them? If we can't avoid them, how can we reduce the harm associated with them? Just like we do for motor vehicles. But because it is smokers, and there's this lens where society has not accepted them, we've basically ostracized them from society. They are basically not seen. Even though we have challenges with alcohol, in my community, when people throw a party, they'll give you alcohol, but nobody gives you cigarettes when you go to their party, because smokers are not seen, and education doesn't help. So smokers cannot mobilize for themselves. Even with people living with HIV, as doctors, we left them to their own. Because they were dying daily. It was graphic, it was visible, it was intensive, it weighed on the system. Some of us had to wake up to the realities that people living with HIV faced in our country. And we pledged solidarity with them. As the chair of the association, I got the association to become a member of the Treatment Action Campaign. Now, for smokers, there's no such relief, because active smokers are seen as bringing it to themselves. And what aggravates it is the history of the tobacco industry and the hatred of the tobacco industry from public health and the WHO. And smokers are the victims of that hatred. Hatred is toxic. Hatred will always make human beings do irrational things. Now, the challenge for Africa, the challenge for South Africa, the challenge for LMICs is the conduct of the WHO in this matter. They cannot live up to the true terms of the FCTC. There's Article 1D that talks about harm reduction. When it was written, there weren't any products except for snus, which the WHO banned. And we know what has happened in Sweden, where snus was not banned. And there's a challenge about a problem where people don't take accountability. If the WHO was run by people with a conscience who think people who smoke matter, they would be making amends for having banned snus with disastrous consequences. The article that came up in 2020 that says if snus had been adopted in Europe, 350,000 lives could have been saved. But nobody does anything about it. So our problem in Africa emanates from the attitudes of the WHO, where the FCTC, which is a framework convention for tobacco control, written for combustibles, is now being used to force consumers to combustibles by being untruthful about the relative harm of the non-combustible alternatives. That is the key, that is the challenge, and that's what we need to deal with. We have a challenge in many African countries where a significant portion of our health expenditure comes from donations facilitated by the WHO. So there is no ability not to listen to what the WHO says. And the challenge we have now is to speak truth to power that is being abused by the World Health Organization. We need frameworks that accept the fact that these products are less harmful than combustible products. I ask myself, when we come up with legislation that does not differentiate between the two products, that when you do not combust, you reduce harm, why would the medical profession have supported nicotine replacement therapy? If, as is being suggested, nicotine is now being labeled as highly addictive and highly toxic in the proposed bill in South Africa. And I'm saying, does it mean we as a medical profession have lied to society by providing nicotine replacement therapy? It is time we tell the world and we tell the WHO that people who smoke matter. Their lives matter. It has an impact on all of our societies. My father smoked. I've been a passive smoker all my life. One of my kids uses nicotine. Many of my nieces and nephews use nicotine. And I need an enabling environment to educate them properly about the dangers of combustible cigarettes. That if they can't quit, they can't be left to die. We cannot sacrifice 30 to 40,000 lives in South Africa on the altar of trying to protect the youth. Youth uptake should be discouraged. We should work together about what we do about youth uptake, but it should not include prohibition or banning of products that will reduce harm to adults. Prohibition is abdication, because when you ban and prohibit, you can't educate, you can't protect, you can't ensure that people have access to safe products. And that should not be allowed. We need to ensure that there is access to alternatives. The alternatives are affordable, and society is educated about the benefits of avoiding combustion. Taxation becomes important. Pricing becomes important. But the way we save lives is by educating. It's by empowering. It's not by distorting facts. When you have 70% of doctors saying that nicotine causes cancer, you know that we've got a huge mountain to climb, in the words of Nelson Mandela. And we need to ensure that we change the WHO to be a protector of all humans, including the 1.1 to 1.3 billion people who smoke. They should not be sacrificed at the altar of hatred. Trust is not compulsory, but we all need to respect each other. All of us have to be at the table. So we need to ensure that this secret club at the COP10 is disbanded. NGOs should be at the table, not the ones selected by the WHO, the ones that choose to work in the space. People who smoke, people who vape, they should be at the table. The industry should be at the table. The WHO should promote science and not take sides. And we need to ensure that the truth is spoken. I'm tired of dilly-dallying. For those of us in low middle income countries, WHO, which is supposed to protect us, is the one that is causing most harm. The WHO promoted COVID-19 vaccines on an experimental basis when we didn't know about the safety profile of those drugs. We know the safety profile of snus. We know the outcomes of introducing non-combustibles to your society. The gateway theory has been debunked. It is time we stood up for truthful information. It is time people are given the truth, credible information, and we ensure that markets ensure that there are alternatives that are affordable. In our countries, it's usually the poor that are dependent on nicotine. And they need to access less harmful alternatives at an affordable price. The governments need to come to the party. The WHO needs to come around. We need to regulate based on science and based on policy. And like I said, people who smoke, their lives matter. And it's time that they are seen in society.